We've been examining the role of the family in most of our discussions here, but our emphasis has almost solely been on the parent. But what about other family members? What about siblings, for example? In what follows, two sisters of a child with autism ask two critical questions. What is the role of siblings in the treatment? And how do behavioral interventions prepare siblings for extreme behaviors like self-injury?
My name's Cassie Clavin. I'm 14 years old. My sister is Caroline Clavin, and she's 11, and she has autism and severe behavioral issues. And Dr. Taylor, my question is, when you walk into a home, how do you assess the role of the sibling?
That's a really good question. It depends on the age of the sibling, right? It depends on the sibling's interest in whether they want to participate or engage in any kind of therapeutic intervention or participate in some education around their sibling with autism. And so for very young children, it depends. So if you have a young child with autism and an older sibling, sometimes that older sibling may be a little bit more interested and actively engaged. If you have an older individual with autism and a younger sibling, sometimes those younger siblings, they need some education about what's happening, depending on their age, how much they can handle. So it really depends on the age of the sibling. So first, just seeing what the developmentally where that sibling is, and then gauging their interest. And so some families, they don't want the siblings involved at all. I mean, the parents, it's their choice. And then some siblings want to be involved, and so they might ask to be involved. And so it's about really working with siblings on an individual basis, just like you would work with a child and just like you would work with a parent. And so we tell parents you don't want siblings to have a lot of pressure or stress to implement certain things with a child with autism, but you want them to know that they do play a role, and that role, when they're ready, is there. And if they want to participate to the least or most based on what they're interested in.
Hi, my name is Abbie Clavin. I'm 16 years old. My sister is Caroline Clavin. She's 11 years old. And my question for you, Dr. Taylor, is how do you approach behaviors like self-injury and aggression in relation to the siblings?
You know, those behaviors can be very scary for everybody in the house. And it can be particularly scary for siblings, younger siblings, who may not understand why the behavior is occurring, what the behavior is about. And so we work with families to do what they can to really protect the siblings in the home. And protection means that the child has to have a way, the sibling has to have a way to get out of the situation, how to respond to the aggression, how to respond to the self-injury in a way that's first and foremost protective to the sibling, and second, being able to be in some ways responsive so that it's not causing more problems if the sibling responds in a particular way. And so sometimes, again, siblings need a lot of answers to questions, and sometimes those are hard questions that siblings that need answers. And so if there's a highly disruptive behavior in the home, what we try to do is we try to help the sibling understand that it's not about them, it's not their fault, this is something that's occurring, and how they can manage it. Just like we would help the parent learn to manage it, we would help the sibling learn to manage it. But I think that sometimes siblings just need an out. They need a way to know that they feel safe and that they just want to be away from whatever the situation is, and that families need coaching on how to interact with their other children around the child's problem behavior. And so, you know, the good news is that siblings of children with autism turn out just as good as anybody else. So if anything, the research shows they develop a lot of empathy and a lot of care. And I think that for families, there's this fine line between engaging their other children in the therapeutic process with the child with autism and then setting some boundaries around that so that siblings also have some distance from what's happening. And so when there's extreme problem behavior, we really like to educate the sibling and help the sibling feel safe and help the sibling have the tools necessary to respond to the behavior just like a parent would.